Dwight Landry, and I'm going to perform the assessment of the neck vessels in the heart. Hi, Ms. Landry, how are you today?
I'm good.
Good. Would it be okay if I would assess your neck vessels and listen to your heart?
Yes.
Okay. First thing we're going to do is we're going to have the patient lie down at a 30 to 45 degree angle, which is what we're trying to achieve here. I'm going to next ask her to take her head and turn a little bit to the left. Next thing we're going to do is I'm going to look for the internal jugular pulsation, which is located up here near the suprasternal notch. Okay, so now that I do have the pulsation identified, next thing I'm going to do is I'm going to get a ruler that measures centimeters, and also I'm going to have a little straight edge, and I'm going to measure the internal jugular pressure. Can you turn your head for me, please? So next I'm going to find the angle of Louis, and then I'm going to find the pulsation. And again, in a hospital setting, we would have a transgenial light which would shine bright here so we could identify it easily, but I can definitely see it. And looks like we are at about 1 centimeter. Okay, so once we complete the examination, we document that what the internal pressure was measured in centimeters, and we would denote the angle that we found the pressure. Also, in the hospital setting, we would check the internal jugular pressure at 30 degrees, 45 degrees, and at 90 degrees, and let the physician know the different pressures at the different angles. So the next thing we're going to do, she's going to turn her head just like she is now, back straight again, and we're going to auscultate the carotid arteries. And we're going to use the bell of the stethoscope to do this. And once we finish auscultating, we'll palpate. First thing we're going to do, when I place the stethoscope on the carotids, I'm going to ask Ms. Landry to hold her breath. And the sounds we should hear, we shouldn't hear any sounds at all, actually, which would be a normal finding. If we were to find that we heard turbulent blood flow or something, or a swishing sound in the carotids, this would be an abnormal finding, and we need to let the physician know. So now we're going to go ahead and listen. Okay, hold your breath for me. Hold your breath for me. Okay, everything sounds normal. The next thing we're going to do is we're going to palpate the carotid artery and carotid arteries. We're going to do the carotid. We're going to palpate them individually. Starting with the right, and then the left. Okay. The pulses feel equal bilaterally, and about a 2+, which is normal. Everything seems to be fine right there. The next thing, that concludes our neck assessment. So the next thing we're going to do is we're going to assess the heart sounds and at the chest wall. Typically, whenever we would be in a hospital setting, we would ask the patient to have their chest bare, so when we walk in and do the assessment, we'd actually be able to find the apical pulsation. Since Ms. Landry has a shirt on for this demonstration, what I'm going to do is I'm going to ask her to get into the left lateral position. Can you do that for me, please? So once she's in the left lateral position, what I'm going to do is I'm going to come down, I'm going to find the 5th intercostal space at the midclavicular line with my fingers, and I'm going to find the apical impulse. Once I find it, I'm going to palpate that apical impulse with the palmar surface of my hand. Okay. Then I'm going to move to the left sternal border. Same thing with the palmar surface of my hand. Feeling for anything abnormal. And then again at the base of the heart. Okay. Lie back again, please. Then once again, with her lying on her back, we'll go ahead and follow the same procedure again. We'll go right here into the mitral area in the 5th intercostal space, feeling for any abnormal pulsations. The left sternal border and the base of the heart. Everything seems to be fine. The next thing we're going to do is now we're going to auscultate for heart sounds, and we're going to do that in several different locations. First, we're going to start in the aortic area, which is at the 2nd intercostal space in the right sternal border. Then we'll move to the pulmonic area, which is at the 2nd intercostal space in the left sternal border. We'll move down to Erb's point, which is located between the 2nd and 3rd intercostal space at the left sternal border. Then we'll go down to the left lower sternal border in the tricuspid area between the 4th and the 5th intercostal space. And then we'll move into the 3rd and 4th intercostal space. And we'll move down to the 5th to 6th intercostal space to the midclavicular line, and then we'll auscultate in the mitral area. So we'll go ahead and do that now. And we'll use the diaphragm of our stethoscope. Okay. Everything sounds fine. Once we've auscultated the aortic, the pulmonic, Erb's point, the tricuspid area, and the mitral area, what we want to do is we want to find our S1 and our S2 sound. So again, we're going to auscultate right here in the mitral area. And the S1 and S2 are very distinguishable, the S1 being the lug, S2 being the dub. If we had an issue having difficulty distinguishing the S1 from the S2, what we could do is listen, and at the same time we're auscultating, we could also feel the carotid pulse and palpate the carotid pulse, and that would determine the S1 sound for us. Then on S2, if we were having difficulty distinguishing our S2 sound, we could auscultate in the 2nd to 3rd intercostal space, and the heart sound that we would hear on late inspiration would be our S2. Okay, so the next thing that we're going to do is we're going to once again listen to these areas, and we're going to listen for abnormal sounds such as murmurs, gallops, possible friction rub, things of this nature. And we'll start again. We'll go from apical to pulmonic, Erb's point, tricuspid, and mitral. Everything sounds fine. We would also go back and follow this same procedure using the bell of our stethoscope. At this point, I'm going to have Miss Landry sit up and lean forward for me. Now, what I'm going to ask her to do is, as I place the stethoscope on her chest wall, and I'm going to be auscultating the mitral area, the left sternal border, and the base of the heart once again for abnormal heart sounds. And I'm going to be asking her to exhale. So take it in the breath. Exhale. Breathe. Exhale. Breathe. Exhale. Everything seems to be fine, and this concludes the assessment of the neck vessels and the heart. Thank you.